Hello, good morning. This is Dr. Rahman Khan. I hope you guys are doing well. Today I am going to discuss about familial hypercholesterolemia. That means there is a disease called familial hypercholesterolemia when mutation in the gene took place in a patient. This is present from the day of birth, but we don't know it. 85% people with familial hypercholesterolemia, they do not know the diagnosis. Therefore, they don't go for treatment. They don't seek any advice from doctors because they do not know. That is why my recommendation will be check the fasting lipid panel at the age of 9 to 11 according to Heart Lung Foundation of the United States of America. So you are not going to do it for everybody. You only going to do this test for those whose father and mother or sister or brother had a premature heart attack, premature stroke. In that circumstances, you do the test. Otherwise, you will do the lipid panel as per American and Canadian task force. You do the test at the age of 20. Regardless, you have family history of hypercholesterolemia, family history of stroke, or family history of heart attack. Doesn't matter. Premature heart attack and premature stroke and peripheral vascular disease increase the morbidity and mortality of the individual if the patient is not diagnosed and is not treated properly on time. Familial hypercholesterolemia usually do not have symptom, but some patient may develop arcus senilis at the cornea. There is a yellowish tinge at the cornea. Upper eyelid or lower eyelid, there is a yellowish fat deposition, which we call xanthosoma palpebrum, and that kind of xanthoma also present around the body, especially in the tendons of the leg and tendons of the elbow. That doesn't mean that the patient has familial hypercholesterolemia, but if you see a patient with that, of course you do the test right away. You schedule the appointment for next morning to do the blood test for cholesterol, triglyceride, HDL, LDL. If the diagnosis is done, then your primary care physician or consultant will advise you to stick to diet and exercise, stick to Mediterranean diet, which consists of plenty of fruits and vegetables, fish, olive oil, etc. Please remember that if you do not follow the guidelines, then you are at risk for premature heart attack and a stroke. Your longevity will be significantly decreased by 15 to 30 years. Therefore, it is prudent to check for familial hypercholesterolemia. If there is a family history of premature heart attack, stroke, or coronary artery disease or peripheral vascular disease, you do the test and you will diagnose, and therefore you will be good to go. Thank you so much for watching this small video. I am going to discuss about this in details in the days to come. But remember that treatment is available, prevention is available. Therefore, do not suffer from a premature heart attack, premature stroke, and do not die prematurely. Thank you so much for watching. I will see you soon. Have a good evening. Please subscribe my channel, Dr. Rahman Khan, youtube.com, and you go to Facebook. Also, Facebook ID is Rahman Khan. Thank you.